Hi, my name is Riley.
I'm Savannah.
I'm Brittany, and we're nursing students at Davenport University.
Today we're going to be demonstrating pulse deficit. Pulse deficit is the measure of differences between the apical and radial pulse to determine if there is a difference between the two locations by subtracting radial from apical pulses. This is referenced from our Fundamentals of Nursing Volume 2 book on pages 197 through 199. Reasons why we may need to measure pulse deficit would be medications, blood loss, cardiac or respiratory disease, as quoted by European Journal of Preventive Cardiology in 2016. Obtaining a pulse deficit can be one of the first indications of atrial fibrillation.
The supplies needed for this procedure include a stethoscope, an alcohol wipe, and a watch with a second hand.
Now we will demonstrate and explain how a pulse deficit is obtained. Hi, I'm Brittany.
I'm Savannah.
Hi.
We're going to be your nurses today.
We're going to be taking your pulses today to make sure that your new medication is not causing any issues with your heart.
We'll be doing this by having one of us taking your radial pulse on your arm and the other pulse is apical, which will be near your heart.
First, we will clean our stethoscope with our alcohol wipe.
And then we will expose you a little bit on the left side of your chest to get a good reading of your apical pulse, if that's okay.
That's fine.
Now we will have one of our watches in a place where we can both see it to have an accurate reading for both of the pulses that we get. I will now palpitate the fifth intercostal space of the midclavicular line to obtain an apical pulse, right here by your heart.
Once we are both ready to start, I will indicate this by saying start, and I will say stop once 1 minute has gone by.
We will count simultaneously to ensure accuracy. We have to count for 1 full minute to get an accurate assessment of any differences that may be present between the two sites.
I will feel for the radial pulse and assess rate, rhythm, and quality. Once we are both ready to start, I'll indicate this by saying start, and I will say stop once the 1 minute has gone by.
We will count at the same time to ensure accuracy. We have to count for 1 full minute to ensure that there's no differences between the pulses at the two sites.
Start. Stop. The pulse I got was 72.
Okay, I got 72 also.
Okay. After counting the two sites for 1 full minute, we have observed that the pulses were the same, meaning you have no deficit in your pulse and you are good to continue taking your medications.
Okay. In conclusion, pulse deficit is a helpful way to determine if blood flow is regular by subtracting apical by radial pulses. Remember to always wash your hands and wipe stethoscopes with the alcohol wipe before and after procedures, and wear gloves when necessary. Also, be aware of cultural and ethical considerations when moving the gown to obtain the apical pulse.